So today we'll be looking at the liver meridian. So the full name of this meridian is the liver meridian of the foot Jueyin. And because it's a yin meridian of the foot, it travels from the foot to the abdomen. There are 14 points in total, and the common indications between points are for conditions of the head, eyes and lips, the liver, gallbladder, spleen and stomach, the hypochondriac region, and the external genitalia. The course of this meridian. So let's first look at the general flow of the meridian. So as you can see on the image on the right, the meridian is flowing from the foot up the medial side of the leg, then it circles around the genitalia, goes up the abdomen, then moves laterally to the floating end of the 11th rib, and then continues ascending to the liver. From the liver, it has two branches, one branch going up to the throat, and the other branch circling around and back down to the stomach. So now let's go into more detail. So this meridian starts at the dorsal end of the big toe, around the hairy region. This is known as Dadun, liver 1. From here, it travels upward along the dorsum of the foot, passing through ZHONGFENG, liver 4, 1 sun in front of the medial malleolus. It continues ascending to an area 8 sun above the medial malleolus, where it runs across and behind the spleen meridian of the foot Tai-yin. Then it continues ascending to the medial aspect of the knee and along the medial aspect of the thigh. From the thigh, it continues ascending all the way up to the pubic hair region, where it curves around the external genitalia. So now we're over here on the image. So where we left off was at the external genitalia, down here. So we're continuing ascending up the lower abdomen, and then it runs upward and laterally curves upwards and curves around the stomach to enter the liver. So the curve around the stomach is over here, and then it enters the liver over here. And from here it connects with its zangfu partner, the gallbladder. At the liver it branches out, and the main branch continues ascending up the hypochondriac region, and then up the posterior aspect of the throat to the nasopharynx, and connects with the eye system. Running further upwards, so this is the second image on the right, the image of the head. Running further upwards, it emerges at the forehead and meets the ZHONGDU meridian at the vertex, up here. So now let's look at the major branches of this meridian. So the first branch I've called the eye branch, and this branch occurs at the point where the branch meets the eye system, and there it runs downwards into the cheek. So as you can see here, it's running downwards into the cheek, and then it curves around the inner surface of the lips over here. The next branch is the liver branch. This branch occurs inside the liver, where it splits and ascends towards the lungs, passing through the diaphragm. It then runs into the lungs and links with the lung meridian of the hand, Tai-yin. So the frequently used points on this meridian, these are Dadun, liver 1, Taichung, liver 3, Shiguan, liver 7, and QIMEN, liver 14. So now we're moving on to the first point of this meridian, Dadun, liver 1. So this is a Jing River and Wood point of the meridian, and it is located on the lateral side of the dorsum of the big toe. So we're on the dorsal aspect of the foot, this aspect. So what we're going to do is we're going to the posterior aspect of the nail over here, and then we've got to go to the lateral end of it. So this is the medial side, and we've got to go to the lateral side over here. And we point 1 sun posterior to the corner. So this is the corner over here. We're going to be 0.1 sun posterior to the corner of the base of the nail. This point can be used for hernia and pain in the lower abdomen. It can also be used for nocturnal enuresis, urine retention, and the 5 types of stranguria, and also for hematuria. Thirdly, it can be used for irregular menstruation, metorrhagia, flaccid constriction of the penis, and prolapse of the uterus. And fourthly, it can be used for epilepsy and somnolence. Our needling is a perpendicular, shallow insertion of 0.1 cun, or we can prick this point to cause bleeding. The next point is XINGJIAN, liver 2. This is the Xing spring and fire point of the meridian, and is also located on the dorsal aspect of the foot, and it's proximal to the margin of the web of the first and second toes. So here's the margin of the web, and if you remember, we used this in the previous lectures. So we find this part, and then we're going to go proximal to this point. XINGJIAN can be used for stroke, epilepsy, headache and dizziness, redness with pain of the eye, glaucoma, and other diseases due to wind heat of the liver. Secondly, it can be used for irregular menstruation, dysmenorrhea, metorrhagia and metrostaxis, and leukorrhea. Thirdly, it could be used for hernia and pain of the vulva. And fourthly, for enuresis, retention of urine, and stranguria. And finally, it can be used for chest and hypochondriac pain. Needling is oblique insertion, 0.3 to 0.5 cun. The next point is Tai Chong, liver 3. So this is the Shu stream, Yuan source, and earth point of the meridian. This is located on the dorsum of the foot, in the depression distal to the junction of the first and second metatarsal bones. So here's our first metatarsal bone, and here's the second metatarsal bone. And then we distal to the junction, so that's where they touch. Over here, we've got to be distal to this. And as you palpate downwards, you're going to feel a depression. Liver 3 is located in this depression. So because Tai Chong is a Yuan source point, this means that it has a more direct action on the liver organ. So you'll see this in the indications, as it's got a much broader scope, and these are all related to dysfunction of the liver. So it can firstly be used for apoplexy, epilepsy, insanity, and infantile convulsions. It can also be used for headache, dizziness, tinnitus, and redness with pain and swelling of the eye. Also, deviation of the mouth and pharyngeal pain due to wind heat of the liver meridian. Thirdly, it can be used for gynecological problems such as irregular menstruation, dysmenorrhea, amenorrhea, metorrhagia, and leukorrhea. It can also be used for jaundice, hypochondriac pain, abdominal distension, and vomiting. Fifthly, it can be used for retention of urine and nocturnal enuresis. Finally, it can be used for capsulitis of the big toe and numbness and pain of the lateral aspects of the lower extremities. Needling is perpendicular insertion, 0.5 to 0.8 cun. So as you can see from this point, there's a lot of indications here, and this point is quite frequently used in clinical practice. And it is also one of Ma Danyang's heavenly star points. The next point is ZHONGFENG, liver 4. So this is a Xing river and metal point of the meridian, and is located on the ankle anterior to the apex of the medial malleolus. So if we look at the image on the right, here's the medial malleolus. So we're anterior to this in this direction, and we're in the depression medial to the tendon of the muscle of the tibialis anterior between Shangqiu, spleen 5, and Zhi, stomach 41. So let's bring in two pictures. Here's spleen 5 at the top, and here's stomach 41. We've got to be in the depression between these 2 points. This point can be used for hernia, nocturnal emissions, dysuria, lumbago, abdominal pain, and pain and swelling of the medial malleolus. The insertion is perpendicular, 0.3 to 0.5 cun. The next point is LIGOU, liver 5. So this is the luau connecting point of the meridian, and is located 5 cun above the apex of the medial malleolus. So once again, we find the medial malleolus over here, and we've got to go 5 cun superior, and it's in the depression between the medial border of the tibia and the gastrocnemius muscle. So here's the gastrocnemius muscle, runs like this, and here's the tibia, looking for a depression between these 2 points. This point can be used for irregular menstruation, leukorrhea, prolapse of the uterus, and pruritus vulva. Secondly, it can be used for dysuria, and thirdly, for hernia and pain and swelling of the testes. Needling is horizontal insertion, 0.3 to 0.5 tun. This is because the tibia lies below this point, so if we go perpendicular, we're going to hit the tibia. The next point is ZHONGDU, liver 6. This is the she-cleft point of the meridian and is located 7 tun above the apex of the medial malleolus. So here's the medial malleolus, same as the previous point, and this time instead of 5 tun like liver 5, we've got to go 7 tun above it. And then we posterior to the medial border of the tibia. So this is the medial border over here. And then we've got to be just posterior to it. The indications for this point, it can be used for hernia, abdominal pain, metorrhagia and metastasis, and excessive postpartum bleeding. And thirdly, it can be used for diarrhea. Our insertion is horizontal, 0.5 to 0.8 tun. And as you can see on this image, both these points, liver 5 and liver 6, lie above the tibial bone. So this is why we cannot insert perpendicularly. The next point is QUQUAN, liver 7. This point is 1 tun posterior to YINLIAN, spleen 9, over here in the image. So we find spleen 9 and we're going to go 1 tun posterior, and it's in a depression inferior and posterior to the medial condyle of the tibia. So here's the medial condyle of the tibia, and we've got to be inferior and posterior to this point as well. The indications can be used for pain of the patella and knee, and pain of the lateral aspect of the lower extremities. These are all local functions. The insertion now is perpendicular insertion, 1 to 1.5 tun. And as you can see, this is because this point is no longer lying over the bone, so we can now go deeper and perpendicular. The next point is QUQUAN, liver 8. This is the Hersey and water point of the meridian, and is located superior to the medial end of the popliteal crease when the knee is flexed. And you have to flex the knee, and as you can see in this image, the knee is already in flexion. And then it's at the medial end of the popliteal crease. The popliteal crease is here at the back. We've got to find its medial end. And it is also in a depression anterior to the tendon of the semitendinosus muscle over here, and the semimembranosus muscle over here, and it's posterior to the medial condyle of the tibia. So here's the tibia, we've got to be posterior to this condyle, and it's 1 tun anterior to YINBAO, kidney 10. And kidney 10 is over here. So the indications, it's used for irregular menstruation, dysmenorrhea, leukorrhea, prolapse of the uterus, pruritus vulva, and postpartum abdominal pain. It can also be used for nocturnal emissions, impotence, erectile dysfunction and hernia, and thirdly for dysuria. And its local functions are for pain and swelling of the knee and atrophic debility of the lower limb. Needling is a perpendicular insertion, 0.5 to 0.8 tun. The next point is YINBAO, liver 9. So this point is located 4 tun superior to the medial condyle of the femur. So that's this bone now, we're at the femur. Here's the femur. And here's its medial epicondyle over here. And we've got to be 4 tun superior to this point. And it's between the vastus medialis muscle, this muscle over here, and the sartorius muscle, which is this muscle that runs or wraps around like this. So we're between these two muscles. This point can be used for irregular menstruation, dysuria or enuresis, and finally for pain in the lower back and abdominal pain. Needling is perpendicular insertion, 0.5 to 0.7 tun. The next point is ZUWULI, liver 10. This point is located 3 tun below Chi Chong, stomach 30, up here. And it's at the root of the thigh, inferior to the pubic symphysis, over here, and on the lateral border of the abductor longus muscle. So here's the abductor longus muscle, we've got to be on its lateral border. This point can be used for pain of the lower abdomen, dysuria, prolapse of the uterus, pain and swelling of the testes, and scrofula. Needling is perpendicular insertion, 0.5 to 1 sun. The next point is YINLIAN, liver 11. This point is 2 tsun below Chi Chong, stomach 30, up here. We're now 2 tsun instead of 3 tsun. It's also at the root of the thigh. So what this means, it just means this part of the thigh, the root. And it's inferior to the pubic symphysis over here and on the lateral border of the abductus longus muscle. So as you can see, this is very similar to liver 10's location. The only difference is it's 2 tsun instead of 3 tsun. So that puts it over here. The indications, it can be used for irregular menstruation and leukorrhea and pain in the lower abdomen. And our insertion is perpendicular, 0.5 to 1 tsun. The next point is GMI, liver 12. So this point is in the crease of the groin. So this is the groin crease here. And it's in the area near the femoral artery. Here's the femoral artery highlighted nicely on the left side of this patient. And it's 2.5 tsun lateral to the anterior midline. So here's the midline. And we've got to go 2.5 tsun in this direction. This point can be used locally for pain in the lower abdomen and hernias and prolapse of the uterus. Needling is perpendicular insertion, 0.5 to 1 tsun. And then I want you to be aware here that you have to avoid puncturing the femoral artery when needling this point. The next point is ZHANGMEN, liver 13. So this is the front mu point of the spleen and the influential point of the ZHANG. It is located slightly anterior and inferior to the free end of the 11th rib. So if you remember from the previous lecture, we had to find another point with a similar location to this. Anyone remember which point this is? This point was GB25, which was anterior and inferior to the free end of the 12th rib. So remember I said in that lecture as well, try not to confuse the location of these 2 points. And now let's look at the indications of this point. Firstly, it's the front mu point of the spleen. So can you remember what we said the function of front mu points are? So they more effectively treat the associated organ. That means that this point can be used for disorders of the spleen organ. And you can see this in the first set of indications. It can be used for abdominal pain, abdominal distension, borborygmus, diarrhea, vomiting, and other stomach and intestine disorders. But this point is also an influential point of the ZHANG. So the influential point of the ZHANG can treat any conditions of ZHANG organs. It can also be used to treat conditions of the other ZHANG organs, such as the kidney or the spleen. Then if we look at the second group of actions, it can be used for pain in the hypochondriac region, so that's a local function, also for jaundice and mass in the abdomen. Needling is perpendicular insertion, 0.5 to 0.8 tsun. The next point is QIMEN, liver 14. So this is the front mu of the liver and is located in the 6th intercostal space. So we'll count down to the 6th intercostal space over here, and it's 4 tsun lateral to the midline. So because this point is the front mu of the liver, you can see in its indications it's all associated to dysfunction of the liver organ. This is symptoms such as chest and hypochondriac pain and fullness, vomiting, acid regurgitation, hiccups, abdominal distension, diarrhea, and other disorders of the liver and stomach. It can also be used for mammary abscesses. Needling is oblique insertion or horizontal insertion, 0.5 to 0.8 tsun. And care must be taken here as deep insertions or perpendicular insertions have the risk of puncturing the lungs. And that's the end of the liver meridian. So this meridian had 14 points, and it is actually the final meridian of the 12 main meridians. So next we're going to look at the 2 most commonly used extraordinary meridians, the Rin meridian and the Du meridian, as both these meridians have their own points, whereas the other ones, such as the Yang linking vessel and the Yang heel vessel, these ones don't have their own points, but share points on the 12 main meridians. So next, we'll be looking at the Rin meridian.